What's up, Foxy people? Welcome back to my channel. Today we're doing another story time. I know, but I need to explain where I've been. So I feel like I'm pretty consistent with videos. Like I upload pretty good and then nothing for like a month. And then upload again, nothing for a month. And that's because I've been going through quite a bit of some medical stuff for about the last year and a half. And I just wanted to let you guys know, fill you in, let you know what's been going on with me, since it's a constant question. Like I'm like a medical mystery right now. And yeah, just kind of let you know that you are your own advocate for your own health. And if you don't like an opinion from someone, then get another one. You know your body better than anybody else. So you know when something is wrong. Even if the doctors tell you it's not. Mind you, if you're like just searching for something so you can get certain medications or something, obviously. But when you are feeling pain or suffering from some chronic something and you're just not getting answers, like you know when something is wrong with your body. So fight for it. Fight. Now, little disclaimer, this video is going to get a little TMI in some sections. There's actually one section that I'm going to tell my kids to turn away if they're watching this, and I'll just put a timestamp on the bottom. I feel like this information kind of has to play into the story. So let's get into it. A little bit of a backstory leading up to what's been going on now. So when I was 14, started going through puberty or whatever, I started developing ovarian cysts. Now, ovarian cysts are super common in females. Like, I think it's like 96% of women develop ovarian cysts in their life. But the thing is, usually you don't even know about it. You don't have any symptoms. You don't have any side effects. They're just there, living their best life. However, mine always rupture and causes the most extreme pain. And I know a couple other women that have had ruptured cysts, and they've said like it's worse than kidney stones. It's worse. Like I've had a child. It's worse than childbirth. Like it's the worst pain ever. A ruptured cyst. On top of them rupturing, like usually when they rupture, they only have pus in them or bile or whatever. Sometimes they'll have blood in them, which makes the pain even worse. Sometimes I've never had these ones, but I have even heard that sometimes they'll have like hair and teeth. Yeah. I've never had those ones, thankfully, but I have had the blood ones and then just the normal ones. And on top of that, mine gets so big. One time I had one that was 8 centimeters in diameter. Like they were going to have to go in and surgically remove that one, but then it ruptured and I ended up being admitted into the hospital for that one for a couple days. That was actually my first experience with Demerol. And again, I was only like 14, 15, and apparently it was quite the experience. Like I saw pink flying elephants or whatever. My mom was like laughing at me because I was just laying in my bed giggling, and she's like, what is going on? Like, you see something, don't you? Now, the only way to stop these ovarian cysts is to be on some form of birth control, because the ovarian cysts develop when you ovulate. So to stop ovulation, you have to go on birth control. Now, keep in mind, but I know both my sister-in-law and one of my friends, they actually developed cysts while on birth control. So of course, everybody's body is different, so consult with your doctor if either of these are happening. So I've been on birth control since I was like 14. However, my doctor explained it to me that I have overactive ovaries. So whereas most women will release 1 egg a month, I will release 1, 2, maybe even 3. They wouldn't always be viable, so I was told that I could possibly have problems getting pregnant because of the fact that I release multiple eggs a month. They're not always like 100% not fertilized, because that's what happens when the swimmers get to them, but they wouldn't be 100% like ready to go. They'd be like dead eggs basically. Now with that overactive ovaries, comes the fact that I could be on birth control for 5 years. The minute I stop it, that wall is like tore down, and within a month I have a cyst. And usually, anybody that knows, like usually if you're on birth control for 5 years or a long period of time, like say you get off birth control because you're trying to conceive, they'll even tell you like be careful for the first year. Use protection because that medication is still in your system and it could cause you to have a miscarriage and that kind of stuff. So you would think that with that medication still being in my system, I wouldn't be able to ovulate and form these cysts. But nope. The minute that medication is out of my system, boom, a cyst pops up. I'm now on the shot, the birth control shot, the Depo shot, and that's for 3 months, right? If I go a day, 2 days past that 3-month mark, I'll get a cyst. Like, it's insane how quick it happens for me. Along with the 8-centimeter diameter cyst, like I would have multiple ones sometimes, some on both ovaries. Like usually it's always on one side. I personally have had the majority of my problems on my right side, but there was some times when I was younger that I would have them on both sides at the same time. About 6-7 years ago, I was experiencing what I thought, now mind you, every time I had my cyst pain, usually I would know what it was. I could even feel it coming on. Like I would know, like, oh yeah, I have a cyst. Rest. Don't do anything strenuous to make it rupture. Like, just be careful. And usually I can control it. But then there's sometimes where it's like for 2-3 days, I could feel it coming on. And then bam, that one day it's just unbearable. I knew it ruptured. I go to the hospital. Unfortunately, when a cyst ruptures, there's nothing they can do about it. There's no treatment. All you can do is rest and relax. They will test your blood because very rarely the cyst could contain toxins like your appendix, and that could become very dangerous, obviously. So they monitor a fever and check your blood and make sure that none of that has ever happened. I actually had that happen one time in 20 years. And it, luckily, like, I didn't get super sick from it or whatever. The pain is extreme, and I have pain medicine at home, and there would be times where when it ruptured, those pain pills were not touching it. And I mean, they're pretty strong pain pills, and they would not touch the pain. So unfortunately, I would have to go to the hospital and get a shot of morphine, and it was the only thing that could relax me enough to be able to rest and let like all the fluids kind of suck up into the body. So yeah, I would say maybe 85 to 90% of the time that I had that extreme pain that I had to go to the hospital, they would do an ultrasound. They could see that the cyst had ruptured. They could see the sac. They could see the extra flowing fluid. They straight up said,
yep, cyst ruptured, that's what it is. Here's your painkiller. Go home and relax.
But then there was that other 10 to 15% of the time where they would say,
nothing showed up on the ultrasound, so like we don't see anything, so it must just be another ruptured cyst. Go home and relax, blah, blah, blah.
And like, in hindsight now, I'm thinking about it, and it's like, but that 85 to 90% of the time, you saw the cyst rupture. You saw the evidence of it. So, but now you're telling me it's the same thing, even though there's no evidence of it. Like maybe it's not that. Maybe it's something else. I personally believe that because they know I have a history with ovarian cysts, they don't look for anything else. Automatically, they just say, yep, that's it. For the longest time, they couldn't even find my appendix. They would do the ultrasound looking for the appendix because it's always the right lower abdomen, right? So looking for the appendix.
Meh, we can't find the appendix, so obviously nothing's wrong with it.
Huh? You can't find an organ that is supposed to be there, but it's okay. There's nothing wrong with it. I was very confused about this. Now they explained it to me that
if it was inflamed and in risk of being in danger, no matter where it is in the body, we'd be able to see it.
I said, okay. But like, an organ is not where it's supposed to be. Is this not a problem? Like, I don't understand it. But you know what? They went to medical school. They got, okay. So about 7 or 8 years ago, I was having my cyst pain. And I'd go to the hospital and they'd say, can't see anything, must be a cyst rupture. Now, usually when this happens, usually when I did have a cyst rupture, it was like that one extreme day. And then like about 4 days, it starts to kind of, like, what's the word I'm thinking of? Teeter off, I guess. Like, it would be very extreme and then, okay, slowly getting better over 4 days, right? Now this time, it was like, it wasn't getting better. And every week, it was like the same extreme pain. And it's just not getting better. And I keep going to the hospital and they keep saying,
Nothing's wrong. Must have been a cyst. Blah blah blah. Can't find your appendix. Must have been a cyst, even though there's no evidence. Must be a cyst.
and it was going on, it was like 3 months. And I'm like, okay, this is ridiculous. So one night after work, I drove to London. Now, anybody that's local knows what that means. But I live in a small town. Doctors here are fantastic, but like London is the big town, the big hospital. The doctors there are supposedly 10 times better than the doctors here. So after work, I literally left work and drove to London, and I went to the hospital and I told them, you know what, I was visiting my cousin who lives here and I just started having this pain. I don't know what's going on. So yeah, I lied a little, but I needed answers. This was crazy. This was 3 months. Insane. So they do an ultrasound, can't find anything, but can't find your appendix. And it was like 45 minutes this woman was searching for it, and she's like,
Are you sure you have your appendix still?
and I was like, listen, unless an alien went in and took it out without me knowing, like, I've never had my appendix removed. She's like, this is so crazy. So the doctor comes in afterwards and he's like,
So we're gonna find your appendix.
and I was like, yeah, I know, so nothing's wrong, right? And he's like,
No. If we can't find something that's supposed to be there, there's a problem.
Thank you.
thank you. Like, this is what I've been saying for a couple years now. So he sent me for a CAT scan and we found the appendix. And what had happened is it grew behind everything. So like, say this is your intestines, right? Your appendix grows to the side here. Mine grew behind. So he even warned me, like, you know, every time your bladder, bowels, belly, like anything is full, it's now pushing on that little tiny organ and it's most likely going to cause you pain. I'm like, thank you. That makes sense. See? Had to drive 3 hours, but I got some sort of answers. So he was like, you know, go home, talk to your family doctor. We can't do anything here because it's not an emergency. It's not like infected. It's not inflamed. So it's not an emergency. We can't do anything here, but go home, talk to your family doctor, see what can be done. I said, okay. So go home. Between my family doctor and my gynecologist, we decided to do a laparoscopy to check for endometriosis. So did that. That came back fine. And then my family doctor also wanted to send me for a colonoscopy and to check for Crohn's because a lot of the pain is all in that same area. I went for the colonoscopy. That was an experience. They couldn't finish it because my intestines were spasming too much. I guess they only got like a quarter of the way through. So still don't know if I have Crohn's. Never got to finish the test. They just diagnosed me with IBS, spasmodic intestines. So started me on this IBS medication, and honestly, the pain got better. So I'm like, okay, maybe that's what it was. Whatever. Still experiencing my cyst pain here and there, even on birth control, but very rarely when on birth control. So it was like, you know what? Maybe this is one of those things I just kind of have to live with for the rest of my life. It is what it is. I had to switch to the birth control shot about 2.5 years ago. because the pills were making my migraines worse. Now, here's a little tidbit. If you are on the birth control pills and you're getting severe migraines, or you have a pre-existing migraine condition, switch to a progesterone-based birth control. It's the estrogen-based birth control that is causing you to have migraines or causing you to have more migraines. Like, I do have a pre-existing condition, but I only have one, maybe one a month, and that's like if I'm doing something to trigger them really bad. But when I was on this estrogen-based birth control, I was having like 5 to 7 a month. Like, it was insane. We had to switch to the progesterone-based birth control, and the Depo shot is just that. So switch to that, and it's been good. Unless, like I said, unless I let my shot run out, like unless we're right at that 3-month mark, then I'll start experiencing some symptoms. But for the most part, for 1.5 years, 2 years, it's been great. So here we are back, like, as to what is going on currently. I know that was a long backstory, but if I kind of just told you what I've been going through lately, it wouldn't make as much sense. You needed that backstory. So back in August of 2019 now, the pain started up again. And I was a couple days late for my shot, so I thought maybe it was just a cyst and whatever. Went to the hospital, ultrasound showed nothing, CAT scan showed nothing. Must have been a cyst that ruptured, even though there's no evidence. Go home and rest. So I did, and the pain never went away. It was like weeks, and it was still going on. So I went back to my gynecologist, explained everything. He did a couple tests, and like moving my leg a certain way, and that caused more pain. So it was determined it could maybe be a muscle issue or like tendons and ligaments in that area. And he decided to do another laparoscopy to once again check for endometriosis. So that surgery was scheduled for November 7th of 2019. And while he was in there, he decided to take my right ovary and tube, since that's the one that's been giving me the most issues anyways. And I'm done having kids. I'm going to be 36. And my husband's fixed anyway. So, I mean, I'm done having kids. So he took my right ovary and tube out as well, hoping that would help. Because it was also questioned whether the scar tissue from 20 years of ruptured cyst could be causing all the pain as well. So had that surgery on November 7th, 2019. And for a week after the surgery, the pain was gone. I was ecstatic. I was like, yes, okay, cool. We got this figured out. Bah, bah, bah. Exactly a week later, it was like once everything kind of settled back into place, this pain started up again. Now, I call them my twinges because it's not consistent. It's almost like contractions. Like, they'll get stronger and closer together and more consistent throughout the day. So if you hear me say twinges, it's this pain that I'm experiencing. So laparoscopy came back again negative for endometriosis. So I had an MRI scheduled to check for the muscle and ligaments and that kind of stuff. That came back completely fine. I went for a cystoscopy, which is a scope of the bladder, because another symptom was that if my bladder's full, the twinges get stronger. Bladder, bowels, belly, everything the doctor in London said, my twinges are stronger. Went for the cystoscopy to check the bladder because every time I had a urine test at the hospital or the doctors or whatever, there was always blood in it. Not where I could see, but like microscopic blood. So decided to check the scope of the bladder to see if these two things are correlating, but that came back completely fine. I'm just one of those random people that will always have microscopic blood in my urine. I'm a medical mystery. Like, the amount of stuff I've had go on, like, it's crazy. I've already had shingles in my ear. It's just so many things, so many weird things. So I had the MRI, had the cystoscopy, and I also just went, today's Thursday, so last Thursday, I also just went for another colonoscopy. Since the first one we couldn't finish, we wanted to check again because, again, if my bowels are full, it hurts more. And just because of the general area that the pain is in, it's either a problem with like my intestines and bowels and stuff, or a gynecology problem, or who knows at this point. So I went for that last Thursday. I don't have the results from it yet, but I'm pretty sure they couldn't finish it again. And if they did, it's a miracle, because this time, like, my family doctor wanted me to be heavily sedated since the first time I woke up, because of the spasms and stuff. So he wanted me to be heavily sedated so that my intestines wouldn't be spasming and whatnot. And mind you, I'm on medication to stop the spasms as well. But I swear this time I was either less sedated or something. I remember looking at the screen. Like, I was awake and I was bawling my eyes out. I was crying in so much pain. So I don't know. Like, nobody told me anything. So I don't know if they finished it. I don't know if they found anything. I don't know if I'm going to have to go through another one. Like, I don't know. Today is February 18th. 2021, and I am still at a loss, and I'm still having the pain every single day since August of 2019, and I've been through so many tests and we cannot figure it out. I personally am convinced that it's my appendix issue. I wish they would just go in and take it out, because I don't need it. What's the point? But because it's never inflamed and it's never infected, they won't take it out. I don't know. I have a follow-up with that surgeon that did the colonoscopy on the 24th. And then with my family doctor on March 1st. So hopefully I'll find out what the next steps are then. Hey guys, ignore the unconventional backdrop here. I'm in my van and I just wanted to get this update out so that I can get this video up and explain to you what's been going on and stuff. So I had the follow-up with my surgeon as well as my family doctor, and it was just another clear test. Basically he said he checked the appendix and it wasn't inflamed, and he has no reason to want to take it out. He will not do it. And like, nothing else wrong with the bowels, no Crohn's, no nothing like that. So back to square one, not knowing what the heck's going on. Me and my husband were talking about possibly even saving up money, and when the border opens, going over to the States and seeing a doctor over there. My family doctor said it would be like 10 grand though. So we'll see. I'm super annoyed because nobody is, like, this surgeon even said, like, oh, it's not appendicitis. I know it's not appendicitis. I've known that. I'm not saying that's what it is. But nobody is taking that into consideration. Nobody even thinks it's a possibility, except that one doctor. I wish I had his name and stuff. Yeah, it's so annoying. It's really, really messing with my mental health, because like, I'm so sick of everybody seeing me in pain, my family, my husband and stuff. Like, I'm sitting here crying at night in pain, and it's like, I feel like they're gonna, if they haven't already, they're gonna start looking at me like, okay, what is your problem? Obviously nothing's wrong. Like, nobody can figure out what's wrong, so it's all in your head. That's exactly what it feels like, is that I feel like I'm going crazy, because like, it's real pain, and I don't understand. So long story short, we're going back to my gynecologist and seeing what he thinks, I guess. Just one thing after another. I feel like I'm gonna live with this for the rest of my life. Anyways, I'll update you when I know anything more. But like I said in the beginning, my main point for this video is to advocate for your own health. My family doctor is amazing, and he won't stop fighting until we have answers, which I absolutely love. I know a lot of doctors aren't like that, but there comes a time where like I feel like my family doctor's gonna give up too. And it's like, you know your body, like I said, you know your body, you know when something's not right. So fight for your health. Some other random symptoms that I have that may have to do with this and may not, I don't know. Like I said, the leg test, like I can't really show you, but they have you put your knees up to your chest and then like lay your legs out and like push on it or whatever. It was hurting. If I did that, it hurts that spot like crazy. So the leg test is that you put your legs down like this, which even hurts me, and the doctor would push on the knee or put his hand on the knee, and I'm supposed to try and like force against it, and that causes so much pain in this area. That's why my gynecologist thought maybe it was a muscle and tendon. When I'm having really bad twinges, they'll even radiate into my back and down my leg. This is a spot that my children might want to or should fast forward about just a minute. It's going to be really quick. I'll put a timestamp. Seriously, Alyssa, Aiden, Dave, even anybody that doesn't want to hear extreme TMI, switch over to the timestamp that is on the screen. You have been warned. But intercourse is extremely uncomfortable for me, and like it hurts during and it hurts for like a week after in that spot, not anywhere else, but in that spot. And one time when I was in the hospital, the doctor did an internal exam with his fingers, and like he touched near the left and it was completely fine. He touched over to the right and I screamed in pain, and he's like, oh yeah, that's your ovary. Mind you, this was before I had the surgery to have it removed. So again, that could be scar tissue. I don't know. So again, if my bowels or bladder or stomach, because I had a big meal, anything like that, are really full, the pain is worse. I can't sit like curled up on the couch without it hurting. I can't stretch my legs out a certain way without it hurting. A lot of walking, like if I'm walking for a long time, the twinges get stronger. Like me and my husband went with my son and his Nana out to Holiday Beach one day, and we were walking for like a good hour, and by that time that hour mark hit, the pain was pretty strong. Lifting like full clothes baskets hurt more, or if I've had like a busy day at work and a lot of walking around and a lot of moving and lifting and bending and stuff like that, that causes the twinges to be stronger. Sometimes it happens for absolutely no reason. I did nothing all day and the twinges are out of control. Sometimes that area gets numb, like I could poke it with my nails and I can't feel it. Sometimes I can feel the lymph node swollen in that area. Like it's just, there's just so much. And the fact that we still can't find out any answers just blows my mind. So that's what's been going on with me. Like I said, I want to be consistent with my content because I know it's helping people. And that's the whole reason I started this channel. And I love and support, I love the support I've gotten and the consistent support I have and just your patience. I promise once everything's fixed with me, I will be consistently uploading. I'll have a couple good days and I'll like bang out a couple of videos and film them and then be able to upload consistently. But then it's like I have a week or two of really bad days where I can't do anything and I've run out of the content that I've already filmed. So now it's like I'm back, like I'm behind on my uploading schedule, and that drives me so crazy. And like once I get behind on something, it's like I kind of beat myself up, like what's the point? And with all this medical stuff going on top of being stuck in the house since March, my mental health is extremely struggling lately. And I'm not one that usually has any mental health issues. But I'm used to being on the go and like doing something constantly. And the fact that I haven't been able to do that in almost a year, I almost feel useless because it's like, yeah, cool. I could stay home and make videos all day. But then I'm having such bad pain days that I can't even get up off the couch or out of bed. And it's like I'm falling behind in so many aspects. Like I'm I'm getting emotional about this. Like I'm slacking as a wife, I'm slacking as a mom, I'm slacking as so many things, like doing things around the house, staying on top of laundry, like the smallest things I can't do some days, and it's like it really gets to me. It really bugs me. So I have to give my husband such credit because he has been unbelievably amazing through this whole thing. So patient with me, picking up the slack where I can't, when whether it's the kids or laundry or dishes, whatever the case is, and like being a lot more patient than any man ever would, and just understanding, like I know it's got to be hard on him, just even seeing me struggle and not being able to help me. I know he has a hard time with that too. And just like I said, I'm slacking in so many places, and he doesn't get mad, he doesn't get angry. Like I said, I'm sure it's hard on him, and that breaks my heart so much, but I could not imagine going through this with anybody else. He has been an absolute godsend. It's been a struggle, but I promise you guys that once I have answers, I will be on your screens at least once a week. I'm trying for two times a week, but at least once a week, you'll see this pretty little face with consistent content. I need you guys to be a little more patient. We're over 400 subscribers now, and that like blows my mind, and that pushes me more, like gives me more motivation to keep making the content. Not that, like, even when I had 100 subscribers, I still wanted to make content every week because it was never about the subscriber count or the money or anything for me. It was always about helping people. So, but it's like the more people that subscribe, the more people I can help. That's like some crazy motivation. Like I feel like Mikey from those commercials. Like, they like me. They really, really like me. I know that's not how it went, but you know what I mean? So yeah, just please, just a little more patience. Hopefully I don't have to, like, hopefully I'll have some answers soon. Trust me, I'm over it. I'm so over it. Sometimes it feels like there's no light at the end of the tunnel. Like, it's like when all of these tests keep coming back negative or that they can't find anything, it's like, is it all in my head? Am I crazy? Like, I'm not making this pain up. Like, I don't understand it. I don't understand it. But that is what I've been struggling with lately and why my content is so inconsistent. But I promise, one day we'll get there. And I am absolutely trying my best. And thank you for the continued support. I love you guys all so, so much. And yeah, I'll see you in the next one, hopefully soon. And I'll keep you updated whenever I finally get some answers. Probably on TikTok or Instagram. I'm not going to make like another full video unless it's like a lot of crazy information. But follow my socials if you are interested to find out what's going on with my body. And yeah, I'll see you guys next week. Love you. Painful. Just keep going. I'm trying to do something here, sir. Do you mind?
Bloopers.
Hey, can you move, sir?
Bloopers.
I'm trying to do something.
I love how he never does it to anybody until they're trying to do something.
I know, you never snuggle.
And then the one time you're trying to do something, he like jumps on your lap and is like, "Love me." And she can't get up, guys.